Christina, what's going on? That cough's back again. All right, well, tell me a little bit about the cough. When did you start noticing it? Okay. Well, I would suggest some of the humidifiers that we have, but in your case, since it's been going on so long, I think we may take a different route. Have you been having any sleeping issues with it? Headaches? No? Okay. And do you notice any ear buildup? Because sometimes that can affect your cough. Okay. Oh, and you're having shortness of breath too. Okay. And you haven't had any stressors at work or in your family life? No extra anxiety? Okay. Because a lot of the times it can be anxiety. Yeah. Well, have you tried some herbal tea? Because herbal tea can clear up some of the bacteria in the lungs. Okay, you might want to try that too. Yeah. Would you like to get back on the MS ball? Okay. And it worked last time, right? Okay. Yeah, I can get you prescribed that again. You're still at the 2 West 1 Pharmacy on Oak Grove? Okay, perfect. All right. Well, do you have any other questions for me? No? Okay. Well, if you wouldn't mind sitting up on the table right there so that I can check some of your breathing. Thank you. I'm going to go ahead and put some gloves on. Have you been keeping hydrated in this warm weather? Yeah, because that can help too. You must always stay pre-hydrated. Yeah, sorry I was running late today. I also want to put on some hand sanitizer. But yeah, so. Alrighty. Go ahead and relax your body. Sit up nice and tall. I'm going to have you breathe 4 times, okay? In through your nose and out through your mouth, okay? Okay, here we go. Breathe in and breathe out. Breathe in and breathe out. Another time. Breathe in and breathe out. One more time. Breathe in and breathe out. So it doesn't really look like there's anything wrong with your breathing, but I know sometimes that short-term breathing can just appear out of nowhere, but that doesn't necessarily mean that there's anything wrong with your auto system. So yeah, would you like me to check in your ears for any ear buildup? Okay. Okay, hold still, turn to the left. Perfect, turn to the right. Okay, so there is a little bit of ear buildup. Would you like the medical assistant to come back in and try to clean that out for you? No? Okay. All right. Well, would you like to do the blow test? It says here that you did the blow test a couple years ago when you were in, where you blow out all the candles. Okay. And would you like to have the oxygen inhibitor as well? Okay, I can definitely do that right now. This is going to be kind of a tight squeeze. Can you put out your arm for me, please? Perfect. Like I said, it's going to be kind of tight because we really need to get that vein. Okay, perfect. All right, hold really still, okay? All right, perfect. And with that, you should feel a little bit of temporary relief with that breathing. It's not a permanent fix, but this should give you at least a little bit of relief. Also, I would like to check your tonsils just to rule out anything abnormal and a little bit more serious. Okay, open wide. It's going to go above your tongue in the back. Okay, I'm not seeing any abnormalities, no white spots on your tonsils, so that's really good. And if you wouldn't mind, I am going to stick a finger down the back of your throat just to check your gag reflexes. I know patients don't like this part, but it really does give us some good information about your oxygen levels. Okay, perfect. Open real wide. This will be real quick. Okay, perfect. And I'll take that swab and send it out to the lab department. Okay. Did you have any other questions for me? Yes, I will get that inhaler ordered for you. I will get that referral over to a pulmonologist if none of this other works and you're still having the issues, but I did get the blood draw ready for you, and they're gonna check some indicators to rule out anything more serious, which I don't think it is serious, but it might be. No, as far as the AHA, that's not really something to be overly concerned about, just because, you know, it doesn't really relate to this situation, but we can still get it checked, and then I'll review your x-ray results before you leave today. And yeah, so you didn't do the blow test, you didn't do the ear test, but that's okay. Yeah, I mean, the blow test, it's not all that important. I mean, it's mostly older people that do it. I mean, it can tell us some things, but no, I can definitely still give you that inhaler, yeah. But the swab that I took of your throat should actually be more accurate than the blow test, so you're good there. Okay, all right, well, I'm gonna go ahead and order that immeasurable. You're still at the 221. Yes, you are, okay. I'll get that sent off, I'll get that inhaler sent off, and I will get those results from the blood work to you in a few days, but you should have the x-ray results before you leave today, okay? All right, and like I said also, you might just want to try some meditating to ease some anxiety, and herbal tea can help, sometimes Benadryl, okay? Is there any other questions you have for me today? Well, not exactly. Lung cancer is usually associated more with upper stomach pain, and it sounds like yours is more congestion related. I mean, the blood test will rule it out, but I honestly don't think that you have anything serious. I think it's just mild anxiety, along with probably seasonal allergies. But the immeasurable will probably help, since it helped last time, and if it doesn't, I'll still get that referral into a pulmonologist at that point, and they can assess you further and maybe test for some things that we can't test for. All right. Well, if you change your mind and you want to do the ear test or the blow test or whatever, you can definitely schedule another appointment. Yeah. And in addition to checking your breathing and cough, you still are due for a few other IVs. So, but I'll get the rest of this sent out, the swab, the oxygen, and we'll call you with those results all at the same time in a couple of days. So, okay. Do you want to do the ear test right now then, real quick, before the medical assistant comes back in? Okay, perfect. Okay, well, this will pump water into your ears to get some of that earwax out. Can you lean your head to the side, please? Okay, perfect. I'm just gonna get some water, fill it up here. All right, here we go. All right, here we go. All right, be real still, okay? Okay, we're done with that ear. Can you turn to the other side? Fill it up again. All right, we removed that earwax for you. So that should help a little bit too for some temporary relief. And could you also verify your date of birth for me real quick? Okay, all right. So you're no longer taking the immeasurable, correct? But you'd like to start it up again, okay? Like a wipe to kind of wipe down everything just so your breathing doesn't get worse. Okay, perfect. Yeah, that cough, it sounds like just seasonal allergies, but yeah, I don't think you have anything serious, but like I said, that blood test should rule it out if you do. All right, there you go. Here's a disinfectant wipe. Yeah, once you get your blood draws today, you shouldn't be due for it for another 12 months at least, so you'll be good there. I would just get them done. And I will check the results of that chest x-ray before you leave today. And a few other things. I would like to check your pulse though real quick before I let you go. Is that okay? Okay. I'm gonna check that pulse. Can you put out your wrist for me real quick? And kind of squeeze it with this. Put out your hand. Okay, perfect. Well, all your vitals look really good. So, yeah, I don't think that we have anything to worry about, but practice meditating, get rid of some stress levels, and I think we'll be okay, all right? Now, the medical assistant will be in here shortly to take you back for the chest x-ray, and then she'll send you on over to labs, and you'll have those results in a couple of days, all right? Yeah, and then I'll call you back with everything else in 2 days. Yep. We're gonna get you all figured out today, okay? All right, well, it was good catching back up with you, Christina. Okay. All right, I gotta get on to the next patient, but have a great rest of your day, okay? All right, bye.